Hi, everyone. This is Mayor Sean Patterson Howard, and we are live with our Thursday evening update. We are here tonight with some special guests. These are all wonderful and incredible employees of the city of Mount Vernon, our first responders, our essential workers. And we are just really, really pleased to have them here with us tonight. And as I say your name, if you can kind of just wave, well, your names are on the screen so people will know. We have our Lieutenant Jay Olifiers. He is the commanding officer for our SSD division in the police department. We have our firefighter, Kevin Holt. He is the president of our United Firefighters, United Association of Firefighters 107, the Firefighters Union. We have our chief, Robert Odendo. He is the chief of operations for the Mount Vernon Fire Department, and he's head of our incident command team for the city of Mount Vernon for this incident of coronavirus. We have firefighter Anthony Mitchell, who is a firefighter here in the city of Mount Vernon and who is a COVID survivor. He's come through and we're glad to see you tonight. We also have our Miss Andrea Ayre. She is a code enforcement officer here in the city of Mount Vernon. She works in SSD in the police department, but she is also the president of our local CSEA, Civil Services Employee Association. We have Detective Dave Clark, and Dave is a member of our Mount Vernon Police Department, but he is also a COVID survivor. And we have Deidre Addison, who is a communications specialist with the Mount Vernon Police Department, and as well, she is a COVID survivor. So I just want to say welcome and thank you to everyone for coming on tonight. We really appreciate your participation. And we want to start with our firefighter Holt, because we know that he's on duty and he might get a call and have to jump off. So President Holt, tonight you are representing firefighter 107, local 107. So can you kind of just share with us, what have been some of your concerns and your experience for your firefighters during this COVID season, this new pandemic that we've been dealing with?
Well, thank you for having us here. I want to welcome everybody who's here listening and everybody who's participating. From the fire department's perspective, we've had close to about 29, 30 guys who have been affected by it's some format of the COVID-19 coronavirus situation. That's about 10%, almost 10% of our workforce. So when we talk about the importance of staying home and staying safe, as you can see, I myself, I'm at work right now. I'm wearing a mask. I got gloves on. We are practicing social distancing. And we preaching that to the public, I think that it's important that they take heed to what we're saying. We have had guys infected. We have had guys do self-quarantine. This is a very, very, very serious virus disease out here. It's really hurting a lot of people. It's hurting communities. And you got to give hats off and kudos to the first responders. Some of our concerns, some of the fire department's concerns, let me tell you, I have been a firefighter for 30 years, and I have gone in, hundreds of fires, hundreds of emergency situations. But just the other day when I had to go on a medical call, the thought pattern that the firefighters are going through now when we do something that's so out of the ordinary is literally a little scary. So it's something on our mind. It's something that no matter how protected you are, you're worried about if you're going to be able to you worry about if you're going to come in contact with it. You worry about if you're going to bring it home to your family. So it's a mental blockage also. Sometimes it can be a mental blockage. And these Mount Vernon firefighters are not only doing these medical calls, but we're responding to a tremendous amount of fires, 19 to 20 fires already, and it's only April. So in addition to our normal workload, it's been taking a toll stressfully on the members who are responding to the medical calls.
So, I mean, what were some of the initial concerns and fears, especially around going on some of these medical calls? I mean, you guys run into fires all the time, things that we would never ever do. So, what was your concern around coronavirus?
Well, I think the general concern for everybody is the unknown. You
Mhm.
know, no one really knows how you're going to contact it, or if the measures that are taken are truly the preventive measures. So I think that the scary thing with society and all is just the fact that it's unknown. I have to commend the fire administration, who's worked very hard, very diligent with the Uniform Firefighters Association. We have worked very hard together, and I commend them because they've been supplying us with all the N95 masks, the
Ooh, you muted yourself, Kevin. You got to unmute yourself.
combat
Okay.
this for the citizens. So, you know, the chief, he's the incident commander. He has more details of that area. But as far as, like I said, the concerns, the biggest concern is the unknown. Um, no one wants to catch this. No one wants to catch it and bring it home to their families. I can't speak personally on how it feels to have been in contact because, you know, by the grace of God, I've been pretty safe. But you had, remember, I just worked with firefighter Mitchell right before he caught this. So he caught it, I didn't, but you know, um, again, that's the unknown.
Thank you so much. Thank you. Thank you. So we're going to jump on down and we're going to pull in one of our, our first survivors who's come through this. So we're going to call on our firefighter Mitchell to share with us your experience and how you're doing and when you're expected back to work and what tips you have for people who are going through this. I mean, what do you have to say? What do you want to say to the people?
Well, first and foremost, what I have to say is I thank God because without God, I wouldn't have made it. You know, I appreciate all the prayers from family, friends, co-workers. The chief reached out a bunch of times. You reached out a bunch of times. Just, you know, the amount of love and support from everybody that was praying for me. But this was a very, very situation, and I grew up in Mount Vernon all my life, and I've been in some hairy situations that I shouldn't have been in, some I put myself in, you know, as a younger man, as a young kid, young teen, and, you know, life-threatening situations. But this one, I've been in a ton of fires, just like Kev said. I've been in a ton of fires. I've almost want to jump out of windows. I've, you know, been in a lot of situations and fires, but this situation that I just went through with the COVID was probably the scariest situation I've ever been in. And like I said, I just thank God that He pulled me through. You know, at first I got sick, you know, regular symptoms, and then they just kept piling on. And, you know, after a while, I just couldn't take it no more. You know, I had to have my lady drive me to the hospital, and she took me to the hospital, and they took me in and told me, you know, automatically, you know, you have it, we're going to keep you. And they ran all types of tests, chest x-rays and everything like that. And after a while, they just had to let me go. They said, like, you know, since my chest was clear, which is, you know, thank God that my chest was clear, that they needed my room for somebody who's possibly going to come in and have to be on a ventilator. So I didn't have to go on a ventilator, but the doctor told me, he said, you know, in your condition and things that I'm seeing, you're going to have this for 14 days. And I'm like, nah, I'm strong. Like, you know, I'm tough. Like, you know, I got coworkers that beat it in 4 or 5 days, but he was dead on because that took a hold of my life for 14 days, and it was scary. I woke up 3 o'clock in the morning on the bathroom floor naked, just crying, praying, just hoping that, you know, I had to force myself to breathe, like something that's natural since birth, breathing, but having to force myself to breathe was just different. And I just prayed to God because I got 2 daughters that I have to be here for and raise, and I just didn't want him to call on me and take me away. And I couldn't be here for my daughters. So you know, it was one of the scariest situations that I've ever been through. You know, I had the worst symptoms. I thank God that I didn't have to go on a respirator. And, you know, now I'm doing, you know, much better. It has affected my family in some devastating ways. So, like, you know, I feel a type of way. I don't know if I brought it home to my family, but, it changed my life. It changed my life going forward. It changed, my family's life, things that I'll never forget, experiences and feelings that I'll never forget. And now just going forward is just, I have a lot of questions. I'm very cautious, just wanting to know, like, I return back to work tomorrow. I've been out for a month. I return back tomorrow. And like Kevin said, me and him worked together. That was my last shift. And that was the same shift that, Mayor, you came by with the crew and you was
The
talking to us.
27th.
Yeah. And I was actually, me and Kev talked, I talked, on camera, and we were just telling people then, we had questions and we were just telling people like to stay inside. But I think that a lot of people don't understand the severity of it because it hasn't directly affected them. And until it directly affects them, then they will understand how serious this is. But some people are still like crying to be outside and have barbecues and cookouts and don't care about social distancing or protecting yourself and protecting others. And this is very serious, very, 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 very serious.
How seriously did you take this before you found yourself positive and experiencing your symptoms?
Well, I was torn. Like, I'm like watching the news, but I don't want to believe everything I see on the news. So I stopped watching the news. But then the chief started coming by and Chief Odendo started coming by and he was bringing information, and they started giving us suits and Tyvek suits and gloves and N95 masks and goggles. And you're hearing about people that's passing away. So I'm like, wow, like this is serious, but we're bleaching and cleaning the firehouse twice a day and cleaning the trucks twice a day. And everybody's supposed to be practicing social distancing and staying away from each other. And, from then you knew it was serious because they weren't allowing everybody to go into a house on a medical call like we used to. Everybody was just rushing and do what we got to do. But now it was just one, maybe two of us going in on medical calls. So from then I knew it was serious. So I took all precautions and I protected myself. And how I contracted it while working, I don't know. We had other coworkers that was around. Nobody really knew until test came back positive. But, I feel like at the fire department, we were very, chief put us in a situation to protect ourselves and gave us the, equipment and PPE to protect ourselves. And I feel like, for the most part, we followed directions and did what we had to do.
Okay. Well, I'm just glad that you have come through this. Like you said, we've had conversations and you said it's been a really humbling experience, and I know it has been. But I know as you come back, it's going to inform your leadership. It's going to inform your work. It's going to inform your life on so many different ways, as you've already stated, as you go forward. And so it's strange because, like we always say, all things work together for good. Mm-hmm. And so, I'm sure that there are some life lessons you've learned through this, and they will help you as you go forward. So I want to kind of jump, like you said, in God. And so I'm going to jump over really quick because you've just been talking about him, to Chief Odendo. Chief Odendo, you have been the incident command for this. You've been working on this incident since back in February as we started hearing about it and looking at protocols. But hold on one second. We're going to ask if everyone can just stop for a minute. If you're on Facebook, this is a live video. Can you please share this video? If you are watching this right now, we're asking that you please share this video so that friends and family can get the information. Please share the video. Thank you so much. So Chief Odendo.
Yeah, thank you, Madam Mayor, and thank you to the panel. Firstly, I just want to say I'm thankful to be looking at everyone here because, after hearing the different stories and speaking to some of you directly and hearing about your experiences, it's, so just we're very thankful to be talking to you. So that's first. And then secondly, to kind of piggyback off of what
Chief, I think you froze. So we're going to come back to the chief when he unfreezes. Oh, there you go. You froze for a minute.
I froze up.
Yes.
I was saying that firstly, just I'm thankful that we're talking to all of these people and that we have our staff back coming back to work, and we're hearing good things, good outcomes. And then secondly, I just wanted to piggyback off of what firefighter President Holt and firefighter Mitchell were talking about in terms of some of the concerns, and then also some of the approaches that we took to manage the situation. We're dealing with, and I think we can all agree, this is an unprecedented crisis, and not only in the department, but also in the city. And we needed to take approaches that sort of mirror what we're comfortable in. We're very appreciative to the city for their motivation and their initiative in many areas, but first working properly or working under an incident command system, pulling in all of the different departments that are part of the city and taking a unified approach to this crisis, because the only way to get through something at this level of this magnitude is with a unified approach. Mayor Patterson Howard came in even well ahead of this incident and wanted that from the department and from the city. And whether by design or by projection or fate, we're here and we're forced into this situation, whether we want it to or not. But I think looking at some of the outcomes already, the early outcomes, at least, we look to be going in a good direction. Some of the concerns that we had initially were, for us internally, was just to make sure that we did not have the infection rate that we were really concerned. The infection rate was our biggest issue. We knew that we could not be have any impact to the city and help the citizens if we had members that were out. So we needed early on to take put protocols in place, policies, controls in place to manage some of the issues that would come if we had a massive infection rate in the city. We started as early as February 1st was one of the first orders that we put out, first communications that we put out to the department to start thinking proactively about our responses, the equipment that we were using, and then also the training that we would need to manage this crisis. And then from that point on, just consistently updating and revising things as information became available to us. We all understand, and we've said this throughout this crisis, this has been a fluid situation. Monday, we would get information from the CDC, and by Wednesday, it would be full 180 to that information. We'd have to either retract, or revise, or update policies that we had in place. We understand that we're learning in real time with a lot of this information, but I am confident, that we will get through. We will get through this, and we are, I think, laser focused on a success and returning back to properly functioning and effective government for the city. So, I mean, in a nutshell, that's where we are. And then we can get into some of the details as needed.
Thank you, Chief Odendo. So I also want to pull in from our Mount Vernon Police Department, our Lieutenant Olifiers. And Lieutenant Olifiers has been working very closely with his executive officer, our Lieutenant Charlotte Neal Young, who's unable to join us tonight, in coordinating the Mount Vernon Police Department's response to COVID in our community. So Lieutenant Olifiers, can you just talk to us about how this has impacted the PD and what are some of the things that you had to do in the PD to grab a hold of what was happening here in the city?
Yeah, yes, Mayor. I'd like to thank Chief Odendo and yourself because this is the first time in the 32 years that I've been in law enforcement in this city that this was approached to in a way that everybody attacked it together, and every city agency came together to give their resources, their expertise to push towards, a conclusion. The police department got hit right away, very early in this. And we had an outbreak, and like the chief had said, we were trying to come up with orders, come out with equipment, and everything was changing on the fly. We'd come out with an order, and by the end of the day, it would have to change. Charlotte Neal Young was assigned by you as the COVID coordinator. And she went about setting up a system where we would have daily meetings with our command staff, and we would make decisions and policy that would that would carry us through that day, trying to get through that day because stuff was changing so quickly. One of the first things that we did to try to get a hold on this was to start sanitizing, decontaminating the rooms and the vehicles that the officers were in. We tried to separate the officers and social distance them. And we tried to, as quickly as we could, identify officers that were sick and get them in quarantine or get them, to testing, which is really what between testing, self-quarantine, the sanitizing, and the social distancing, we finally are at a point where we have a handle on this. But it took a good month to fight this, and it was a fight not only with the police department, but a fight that the whole city helped us with. Every agency, I mean, even people in the community who came by and brought food, dropped off masks, yourself and the police commissioner getting extra equipment for us. I mean, without that, I don't know where we would be. And that's the truth.
Absolutely. I mean, like you said, there's so many new terms that have come out around COVID. Unprecedented event in crisis, pandemic, that was a word, but it wasn't a word that we had to use. Social distancing, caution. What do we say? An abundance of caution. Yes, so an abundance of caution. And then we went to social distancing. And now we're talking about potentially reopening and what that looks like. And so this has been, and the other term, it's a fluid situation. So we've developed a whole new vocabulary around COVID, a whole new reality, and we've developed a new normal. And it's going to be very interesting to see how we go forward. And so, as you said, the police department was hit early, but I think even before we knew the officers were hit, we had some of our civilians in the PD that were hit early and hard. And with that, we want to bring in one of our civilian workers in the PD, Mrs. Deidre Addison. So, Deidre, can you tell us, thank you so much for joining us. I'm glad to see you here. I'm glad to see you back at work, and I'm glad to see you doing well. So can you share with us your experience?
I actually came to work and I was notified here that I needed to report to Glen Island to be tested. I had relieved someone who had shown the symptoms and was positive. So I went over to Glen Island, and my husband, who also works here, I had a conversation with him before I left, to kind of go through, did I have the symptoms? Did I not have the symptoms? Was I tired because I was doing doubles because other people were out? So we said, I'm just going to go. I'm going to hurry up and get there and get tested. And then I'll meet you at home, because we were told not to come back for 14 days. And I was tested on a Thursday. And on Saturday, I started to experience the symptoms. I lost my sense of smell. I lost my sense of taste. I had some gastrointestinal issues. And by Monday, I was laid out on the couch and couldn't move. It was like the flu took some kind of strong narcotic and entered my body and decided that I was not moving from that sofa. So isolation was a little difficult for me because I have 3 kids, 2 of which are younger, and one who has autism, so she doesn't understand personal space as well. So I had to build a fort in the living room with several huge couches so that she could not enter and she couldn't get near me. But while I was there, contemplating COVID and doing my research and going on the CDC website and reading people who've recovered, I also ended up looking up some autopsies from the first few people who came out. I came across things that it was really the mucus that was choking people and putting so much strain and pressure on their heart that they were passing away. So I started a regimen of all of my allergy medications, Sudafed, Mucinex, and then I consulted my PCP and, hot fluids every 20 minutes. And, I had to get through it. And I knew that I had to get through it. and I needed to come back to work because other people were going to potentially get it too, because we work in a small space down in the radio room together. Unlike everyone else, I was fortunate to know what day I was infected because the rest of the unit, we all were discussing, you know, what days we work and what symptoms we have and the onset of symptoms and et cetera, et cetera. So it was unlike any illness I've ever had. But, you know, I'm glad I beat it. And Westchester County Medical Department called me yesterday and they're asking for plasma donations. So that's something that I'm trying to set up to go do, because not everyone's going to be able to beat this thing. We need a little bit of science to kind of back us. So, you know, those of us who've come through, I hope that everyone kind of donates their plasma, because if there's a vaccine, if there's a hope, something, anything, you know, not everyone's going to be able to beat this without a vaccine. That would be really good, you know, and it'll slow down the spread and help with curing those who are already ill.
I mean, that's so important. You know, everyone here who's been infected, you have children, you have families. And as you said, you had to isolate at home. You were worried about making your family members sick. You missed being able to interact with them, with your children. And how do you explain to your children that they can't come in and give mommy or daddy a hug or a kiss or anything of that nature, or that you were not able to be there for issues and incidents that came up in your households. And so this is something that's very different than what most people have experienced. It's not the flu because of the level of isolation and the concern around contagion and how it spread. So even if you were in the hospital, you could not have friends and family visit you in the hospital. And, you know, if you've been infected and someone else in your family is infected or dealing with something different, you can't even go and see them, especially if they know that you're someone who's had COVID or that you might still be under a quarantine order. So that makes this very, very different than most of what we have ever experienced.
Right.
And with that, I want to pull in our CSCA president, Andrea Ayers, because she's the union president for the different individuals who are the, I hear your background, who are the civil servants within the community. So Ms. Ayers, okay.
Can you hear me?
Yes, I can.
Hello.
Hi, I can hear you.
This has been very, very difficult because of the panic, and the civil servants that I represent are non-essential, most of them. So it makes when things are changing daily, like one day they would say, okay, everybody is going to work 2 days a week. And then people are complaining, well, we don't think we should have to come in at all because we're going to be exposed. And then the next day it's like, okay, nobody come in. And then people are working from home, the people that can work from home. And then there's still some people that have to come into work, and they're calling me complaining that they're scared and they have family members that they don't want to bring this home to. So it's just been an ongoing thing. Like till yesterday, I was getting phone calls from people that are like, well, what is the union saying about us coming to work? Are we essential? And I guess that's an administration call as far as which civil servants are deemed essential for whatever reasons they need to work. So I'm letting them know, listen, you have to take all precautions. So you will want to be essential, because if there's a layoff, then if you're not needed at work, then you won't be coming to work.
That's right.
So yeah, so be happy that they're calling you back to work because they need you, because if this continues how it's been continuing, it's inevitable that there will be furloughs. So,
and we're at that point right now. That's
right.
Something that we're looking at right now. You know, there's no easy way around it. There are some crucial conversations that need to be had. And when you're not collecting parking revenue and you're not receiving sales tax, and when you know, commercial and residential tax payments are coming in slowly,
Mhm.
That's a lot of how the city pays its bills. So these are things that we're looking at and we're discussing right now. But we'll see
Exactly.
how we go forward. Have you had to deal with this at all, outside of work?
Well, my mother and my brother. My mother was tested COVID positive and she was hospitalized for 8 days. I actually, the day that they told us that the non-essential workers weren't going to be coming back to work, I got sent home early because I was sick and I believe that I contracted it as well, but it didn't hit me as hard. I had some of the symptoms, but it was never a breathing issue or anything like that. But my mother going in the hospital was devastating because it was like we had to leave her in the middle of the night at a hospital and couldn't go in. It was like a scene from MASH. It was raining and windy, and they met us in the parking lot. It was like, you can't go further than this point. So we had to put her in a wheelchair and literally let them just take her in, and we couldn't even follow up to see what was going on with her. It was devastating, but thank God she came through it. They told us not many people in her condition and at her age get through it. So I'm just grateful that we beat it. So we are COVID survivors over here.
I mean, look, there are so many people who are ashamed to say that they're COVID survivors, but I think it's a blessing and an honor to be a survivor because
Amen.
there were other options. And unfortunately, based on all of our social media timelines and motorcades that we've seen going through the city, there are many who have not survived this. And so we continue to pray for their families, and families who are still going through this. And we're just so blessed to know we thank God we haven't lost any of our staff here in the city of Mount Vernon. We've lost residents, and that's devastating. We've lost friends and neighbors. But I can tell you, as the chief executive officer of the city, I'm awestruck, and we were praying that we would not lose anyone on our watch. And so we continue to pray. We don't take any of it for granted. And, we continue to reach out to those who are home just to make sure they're okay and see if there's anything we can do. So thank you so much for looking out for your team. I want to pull in our Detective David Clark, and just kind of looking at you and Mitchell and knowing that y'all survived. But then, like you said, you have the beards, and that's a part of your story. That's a part of you getting through this. And kind of both of you said, well, I don't know if I really want to come on. I'm not looking like people are used to me looking. But guess what? I'm glad to be able to look on you and not look down at you.
Thank you.
So thank you for being here.
Thank you.
So come on, Dave.
Yeah, so I guess I contracted it on April Fool's Day, believe it or not. At the job, I'm in the training unit. So the social distancing piece, I was a part of everything that Lieutenant Neil Young, Lieutenant Oliver, Sergeant Griffin, everything that they had in place. I was actually, a piece of that, getting masks together, gloves. When you came in the building, I'm like, you need a mask, you need a glove. I'm telling everybody what to put on, what to do. I'm walking around with my mask and stuff, and never in a million years would I think that it would have happened to me. And that's the thing that I think a lot of people don't understand. Like Mitch was saying, until it's at your doorstep, people are going about as business as usual. So the day when I came home, I got home about 7 and I'm on the couch, regular routine. My wife goes to put my son to bed. And when she comes out, I was laying on the couch and she was like, you all right? And I was like, yeah. And then she was like, you sure? And I didn't even know, but I was sweating. And she like touched my head and then she was like, yo, you're hot. I'm taking your temperature. So immediately took my temperature and it was, I think it was like 102.4 right away. So like Lieutenant Oliver said, luckily for me, I wasn't one of the first people that got it. So we had all of the protocol that we had and orders coming in every day because I was a part of those meetings in the morning because I'm a part of the PBA. The first implementation is you call Lieutenant Neil Young right away. and you call the desk. And I did all those things. She told me to stay home, and then she got me to testing the next day. But like they were saying, this virus is wicked, and it plays no games. I went through a flurry of things. I know in the beginning you were like COVID survivor. I'm actually still quarantined. This is day 21 for me. I'm still in the room. I'm not out of the room yet because I still have symptoms. It started with the cold sweats. So immediately, my son, I'm fortunate enough, we have 3 bedrooms and one was the playroom. So immediately, as soon as I called the lieutenant, I sanitized all of my son's toys and everything was pushed out into the living room. I got what little clothes I needed, and I immediately locked myself in this room because it also had a bathroom. So in that aspect, I didn't have the issue that Mrs. Addison had because I was away. The toughest part probably is, with my son, he doesn't understand what's going on because of his age. He's not even 2 yet. So it was difficult for him. And it's also difficult for me because, he's banging on the door, daddy, daddy, please, please. He has night terrors where he wakes up at night out of the bed. My wife can't control him. He's banging on the door. And it's one of those things like, I want to bust the door down, but I can't. I started with the sweats, the chills. My body was shaking and my teeth were chattering like I was outside naked in like 0-degree weather. And that's how you're sleeping. So basically and that went on for me for my first 6 days. So basically your first 6 days, you're not getting any rest because you're popping the Tylenol because you wanted to bring the fever down. So it brings the fever down in that little moment where you lose chills and stuff, but that may last maybe about an hour, hour and a half, and then it's right back again. I would do the old school thing. Let me put on a sweatsuit. Maybe I'm gonna sweat this thing out. By the time I would wake up, literally the sweatsuit was soaked through and the clothes, and I would have to retake the clothes off, retake the shower and put it on. So that first 5 to 6 days for me was rough. Then by the Monday, the fever came down. The body aches, I forgot about that. That was probably, I would equate it to if I had a fight with Mike Tyson and he's a professional boxer and I'm not. The body aches are out of control. I thought it was first how I was maybe sleeping or laying, but it's a different type of body ache because it's throughout your entire body, your legs, your ankles. You put your feet down off the bed and you actually feel like you're gonna fall down, like you're frail. I've never felt like that. So that subsided, the fever and the body aches. But then I had the issues with diarrhea. My diarrhea lasted almost 11 days, every single day, uncontrollably, where I had to run to the bathroom over and over. I was eating, I was having everything that you see people doing, the steaming, the turmeric, anything you name. My parents are Caribbean, any Caribbean remedy, any medicine, over anything I was doing.
And your mom's a nurse.
And yes, and my mom's a nurse for over 42 years. And as soon as I would eat, I might have maybe 15 minutes to a half hour and it's coming out and it's coming out. And, you're staying hydrated. They're telling you to stay hydrated. I'm hydrated, but all that's coming out is liquid. But at the same time, then that's when the headache started. And then the headache is like, imagine someone just beating you in the back of your head in the fat part over and over repetitively with a hammer. So that was tough also. And then now I'm still stuck with the headaches come still like normal, like actually this is around the time that the headaches normally come. They come like about 7:30 and it doesn't last as much anymore, but I think it's due to hydration also, because one of my doctors was saying If you're dehydrated, it tends to cause headaches. So everyone, please hydrate. You don't have to be sick to hydrate. Just hydrate, drink water, drink some orange juice stuff all day. And then now I still have the cough, which is actually the issue that I have because my son is so young. And that's why I'm still in the room, because on Sunday, I actually retested because I felt better. I called Mitch. I was like, yo, I felt better. I talked to him. His voice sounded different than mine. He was like, yo, but you sound good. So I said, you know what, I sound good. And I retested on Sunday. And then unfortunately, yesterday, I got the results that I'm still positive because there's still, the doctor said, because I still have those symptoms, I totally have to not have the symptoms and then do the retest. So it's just difficult. The most difficult thing right now is just not being able to see my wife and my son, and my daughter, and just any family members. So that's probably the toughest part. What I will say is this is a disease, a virus that you really can't have fear, even though you're fearful, because you actually got to fight every single day, every living moment that you have. Because I got it so late and everything was happening, and like you said, we're losing friends every day, 2 and 3 on Facebook, and it's becoming depressing and it's scary. And then you're hearing the stories that this person was in the hospital, and that's where they died. So once I got in this room, I just made it, I made myself know that I was coming in here and I was working out. Now, the first 5 days, it was a wrap. There was none of that moving around, working out. It was just trying to, get through the chills in your body. But that's basically what I've been doing. I probably walk around this little room, at least maybe 600 times. It's sad because I count. All I've been doing is push-ups, jumping jacks, to get my lung capacity back up, things of that nature. So you can't lie down. And I think that's why we're losing so many people in the hospital, because once you're strapped to that bed, once you have those tubes in you, you can't move. So like Ms. Addison said, that mucus is building up. There's no way for it to move. I had so many people helping me and telling me different things. So, I mean, I don't know. I'm just thankful. I thank the Lord for getting me through. Thank my wife. I mean, she's doing a lot. She got an almost 2-year-old in the next 2 weeks, and he's been off the hook. And it's because I'm in here. So, I mean, I don't know. I don't wish this on anybody. This disease is no joke. And, if I could tell anybody in Mount Vernon, like, please stay inside. I'm watching these videos. I'm watching the stuff people's posting. This thing is serious. It's no joke. I'm a healthy dude. I'm a healthy person, and this whooped me with no problem whatsoever. And every day it was a new adventure, And when I thought the fever was gone, the diarrhea came. When I thought the diarrhea was over, the headache came. When I thought the headache was over, the cough came. So this does whatever it wants to your body when it wants to do it to your body. So the safest thing that anybody could do is, stay in the house. If you have to go out, make it fast, make it quick, social distancing, put your mask on, and, all of that other stuff will be important once everyone is healthy. And if we continuing to do business as usual in Mount Vernon, we're going to continue to look at Facebook and Instagram and see people that we love lose their lives. So please, everybody, just wake up.
Thank you so much. I mean, I don't think there's anyone that is listening, and that's why it's so important that we're asking that people share this, even if after this goes off, share it, because we need people to hear the real stories of real people who are coming through this and have things to share and really want to encourage the community. We know that there is a mask order now for whenever you're outside, and definitely if you're going into supermarkets or stores. You're used to seeing in restaurants, no shoes, no shirt, no service. Now, basically, you see no masks, no service, and they're turning people around. So one of the viewers said that she didn't have any more masks and she had run out of gloves, and she wants to keep food in the house and take care of her grandson and her teenage daughter. So one of the things that a lot of people are using now are the reusable masks. Everyone is so focused on the KN95s, but this is something that we're using when you're first responders, essential workers. If you can get these on your own, that's great. But if you can't, you can get a bandana, you can get, anything. You could tear up an old t-shirt, whatever you can, double up and use it as a covering for your mouth and your nose. So it doesn't have to be a KN95 mask. It can be different things that you have around your house that you can utilize to make a mask for yourself. People are going online, they're going on YouTube, and now that we are, over a month and a half into this, you can even go online and order, reusable masks, and they're just, you could throw them in the wash and keep going. This is going to be something that's going to be with us for the long time. And so I don't want people to think, oh, I'm going to need a mask for another week. No, you're going to need a mask for another few months on one level or another. And Dr. Fauci from the Center for Disease Control is already speaking about the fact that we might see another wave of coronavirus in September. So we really need to pay attention. And even in our community, people are still being exposed. People are still being infected. People are still dealing with sickness. And so regardless of what you might hear and what you might see, and yes, the curve might be flattening, and it might be on a decline to some level or another, but that doesn't mean that we revert back to our old behaviors. That means that we are staying smart and we're continuing to practice, well, they say social distancing, but I had a Zoom earlier and she said, no, it's physical distancing. We just have to be physically distant from one another, but we don't have to be socially distant. We can still connect in different ways. And I think that is something that if we kind of change that mindset, that we're physically distant, but socially we need to make sure that we stay connected so that we can encourage each other, build each other up, help each other get through this, do mental health check-ins, do Zooms with your family and your friends. Some people are doing Zoom happy hours, and the kids are doing Zoom. Even when the communities reopen, I spoke to a lot of our restaurateurs the other night. We don't know what the restaurants are going to look like. Are they going to change the occupancy levels of restaurants because you have to physically keep people distant? Are our children going to be able to go back to school 5 days a week? These classrooms are built for about 20 kids, but in many of our schools, we know they're overcrowded and there are 30 kids in there. So how are we going to keep these kids physically distant? This is going to be a long-term impact. The economic impact on our community is significant. So there's a lot that we still don't know. We're not out of the water with this, and potentially another wave. So let's learn from what we've experienced during this round and prepare potentially if there is another round for how we're going to handle this, what we're going to do. I'm going to say this, Mount Vernon is 4 square miles, right? 4 square miles. And there's not a person that's on this screen right now that I don't know. I probably know Deidre personally less, but I've known your husband and your husband's family since I was about 4. And you're friends with my sister. Y'all have worked together for years. And, everyone else on here I know I've worked with much more closely over the years. And to be in a small community and to see your friends, your neighbors, your colleagues, your church members, your relatives, your frenemies, be impacted, it's serious. And so, there's been some criticism about us having to go out and use alternative means and methods to make sure that we secured PPEs for our essential workers and for our first responders. And to the people who have criticism, I say, miss me with all of that. Because when you know that you have to protect your friends and your family. And that's what my staff is. They're friends and family. They're staff, and we hold them accountable for the jobs that they have to do. But we're not trying to have anyone lost on our watch. And so, we did what we needed to do to secure what we needed to get to protect our staff, and I do it again. So today I triple down. I'm in my office every day, and if there's anyone who ever needs to come and have a crucial conversation with me around it, please feel free. I'm here. I stand in my truth. I don't apologize for it. We didn't do anything illegal, but we did take the necessary steps that we had to make sure that our team was safe, that our family was safe, that our family was protected. Before we really understood what was happening, unfortunately, we had people who were infected, but we wanted to make sure that we flattened the curve within our city so that our essential workers could be here to take care of our community and do what was necessary to maintain the services of our government. And so, I thank each and every one of you. I'm so appreciative of your leadership, of your service. I'm glad to know that many of you are doing well. Some of you are back to work. I think firefighter Mitchell said he's coming back to work tomorrow, I believe. And Dave, hopefully that cough will leave soon and we can see you back. Not because we just want you back in the office, but because we want to know that you're doing well and that you're healed. I've known you for many, many years, all the way before you became a rookie. And Andrea, your mom and my mom, they've grown up since kindergarten together. So that's like family. And to know that she was sick, that's hard. This is not easy. And so I'm not just sitting here as mayor. I've been a part of the community longer than I've been mayor. And you guys have been like friends and family. So that's what friends and family do. Friends and family take care of each other, and we don't make apologies for it. Parents sacrifice all the time. And, sometimes we're just in that position where you got to do it. So if anyone, does anyone? Yes, sir.
Madam Mayor, if I could just kind of chime in on and to sort of pull back into what you were talking about, the equipment acquisitions that were made. Listen, as we've been saying and we continue to say, we were learning this crisis or learning in this crisis in real time. And at that time, and it continues even to this point, decisions have to be made in real time.
Ooh, you're frozen.
What happens with in a bureaucracy. So we, the department, appreciates the stance that the city took in making sure that we were protected and that we were safe and that we were able not only to be safe for ourselves, but to go out and help the citizens of Mount Vernon. I live in Mount Vernon, my family lives in Mount Vernon, and there's a certain level of safety that has to be maintained to the city or for the city. And the only way to do that sometimes is that you have to take matters into your own hands. So we appreciate the stance that the city took in making sure that first responders and essential workers were safe.
I mean, we're grateful to the County of Westchester, and the state of New York for the supplies that they've sent down to our community. And we're grateful, but unfortunately what they sent was not enough, and we didn't expect them to supply us with everything. And we've heard on a national level that it's been hard to get PPEs. We've heard our governor talking about really trying to get ventilators and other PPEs, and he even had to call on manufacturers throughout the state to stop things that they were doing and switch over so that they could manufacture masks. And he said at one time, by hook and by crook, we're going to do what we need to do to take care of our state. And so likewise, by hook and by crook, we decided that we were going to do what was necessary to take care of the city. And as leaders, like you said, Chief Odendo, sometimes you have to make decisions in real time, and you don't have the luxury of being a Facebook critic. You don't have the luxury of being a Monday morning quarterback and talk about what should have been done and could have been done and what you would have done. None of us have ever gone through this before, and it is an unprecedented situation. We did nothing illegal. We might have, like I said, used alternative methods. But once again, if I had to do it again, I would do it again. We don't apologize for it at all. And, you know, criticism is criticism, and everyone can be a critic, but not everyone has the responsibility of being a leader. And so I hear what they say: you eat the meat, you spit out the bones, you learn your lessons, and you keep moving and keep walking. And that's what we're doing right now. And we're going forward. And you know, look, right now we're trying to prepare to look at what we've got to do to open, and at the same time, what we have to do to continue to take care of our community and prepare if there is another round of COVID that happens in the community. So, wow, that's interesting. So, you know, Kevin, we can pull you back in. So someone is asking, why is the Mr. Softy ice cream truck still riding around town during this epidemic legally? Well, because food service organizations are considered essential. And so food trucks are still legal within the state of New York. And Mr. Softy is a food truck. Look, the governor has called the state of emergency. The governor gets to make the decisions as to what is essential and not essential. Unfortunately, at the local level, you know, certain of our decision-making powers have been superseded and overtaken by the governor. And so, you know, we respect that. But this is the question. Businesses can be open and Mr. Softy can be moving around, but that doesn't mean you have to use it. And like other people said the other day, when they were talking about opening Georgia, some people said, you know, how could you reopen this and how could you reopen that? Even if businesses are open, that doesn't mean that you run straight into the building on the day that they've opened because they're open. You still have to take, and we're going to go back to the beginning of the new words that we learned in COVID. You still operate with an abundance of caution. Just because things reopen does not mean that everything is still safe. You still have to use your common sense. And unfortunately, common sense is no longer common, but I suggest that you go find it, dig it up and find some common sense if you've lost it somewhere and use it, because this is your life. You know, look, here I sit here with my nails and I'm missing something. I'm missing something, you know. And so everyone's like, oh, Mayor Howard, open up the hair salons and open up the nail salons. And I had closed them before the governor closed them, but because he has oversight, I had to reopen them, and then he closed them. And so I told people, I said, look, you're mad at me because I closed nail salons and hair salons and things of that nature. And you're more worried about being plucked and pretty. You're worried about being plucked and pretty more than you are about being safe. And this is about lives. So, you know, so for my color that's growing in and for my nails, you know, that are looking a little bad,
I'm
hey,
gone too.
I'm not mad about it. See, there you go. I'm not mad about it because guess what? I'm healthy and I choose my health right now over being plucked and pretty. So, you know, we still have to make some sacrifices, and the time will come for you to get your hair done. The time will come for you to get your nails done. Time will come for you to get your beard tight. But we never want the time to come when you're finding yourself sick or hospitalized or on a ventilator, or that we are putting your name up on the sleep in peace, rest in peace, and doing a motorcade for you. So that's just real conversation.
Madam Mayor, I just want to piggyback really quick because I'm on the road right now. I'm actually working for critics out there who are concerned about the accusation of PPE, personal protective equipment. And I think I can speak as the president of the Uniform Firefighters Association, but also on behalf of the PBA, the Teamsters. I can speak on behalf of the CSEA, that we are out here on the front line. And we're the ones who are experiencing life situations. And these gentlemen, these ladies out here, these people out here who are out here working, EMS, doctors, nurses, these first responders, they're out here and they're busting their tail. And it is a scary thing. And I think that anyway, at this particular point in time, we can protect these men and women, these brave men and women who are out here serving the citizens. Any way we can get it done, we need to get it done. Because you don't put a price and you don't put a stipulation on how you're going to save a life. So, and that's what these unions, that's what these first responders, that's what we are representing right now. So I don't know about critics saying anything, but I personally don't care. I'm proud of the work that's being done by all these men and women. I'm honored to be a representative of them, and we're going to keep doing what we need to do to keep the citizens of Mount Vernon safe. And the city is going to do what they've been doing continuously with your heads held.
I think Kevin froze. He's driving around in the car. Oh, there you are. You're back. Thank you so much, President Holt. We really appreciate it. You know, it's an honor to serve with each of you. Yes, I'm your leader, but we also serve together. And we're going through this together, and we're going to survive it together. We're going to rise together, and we're going to take Mount Vernon to the next level together. And I'm just honored and humbled to be able to do that with you. So thank you. I just, you know, we're at the end of our time, but I just want, if you have, you know, parting thoughts, if you could just take a minute, and we'll start with Lieutenant Oliviers. You have a parting thought?
Yeah, I just want people to remember, if they have family, friends in law enforcement and city government, please reach out to them during this time. Please talk to them. You know, it's incredible that first responders, you know, essential workers, when you get home, you don't want to infect your family, so you're kind of isolated. When you're at work, everybody's social distanced. Please reach out to people by phone, talk to them, remember them. You know, one of the most incredible things is I have family members that are sending me articles. My wife almost every day is giving me articles where people are donating supplies to try to get extra stuff. The last thing I want to just say to the city is thank you for everything. The store owners, the people in the city, all the help that they've given us, all the things that they have donated to us, and for asking us when we're out on the street if we're okay. And that's the most amazing thing that I've seen. So, and just a shameless plug, if there is anyone out there, need Clorox wipes.
There you go. So the PD and the FD, if you could drop off Clorox wipes, if you have Clorox wipes or Lysol or, you know, some of those things like that, if you could drop those off at the police station, at the firehouses. This is equipment that they need constantly so that they can continue to decontaminate. I have to give a special shout out to our Deputy Commissioner Damani Bush and our DPW crew, who have been leading the efforts to go around to the police station, to the firehouses, to City Hall and all of the city buildings and make sure that they're decontaminating, because it's not just been the PPEs, it's also been the constant and the consistent deep cleaning and decontamination that is being done by our DPW crew that allows us to continue to do the work that we do. So thank you so much, Deputy Commissioner Bush and our very strong DPW crew. So we're going to jump down to our firefighter Mitchell, and this is kind of like the rapid lightning round of, you know, your parting words, guys. So
first and foremost, I just want to say God bless everybody. Like, you know, keep your faith in Him. Like Dave Clark was saying, this is no joke. So I don't know what other ways we can get out there to reach the people to tell them that this is so serious. And if they haven't taken it serious, hopefully, you know, when they're tuning in tonight, they will take it more seriously, because this has definitely changed my life, you know, in a lot of aspects, a lot of aspects. So protect yourself. I want to thank you, Ms. Madam Mayor, for constantly, you know, reaching out, FaceTiming me, calling me, texting me. Kev reached out, you know, Dave reached out, you know, Chief Odendo, you know, everybody, all of my co-workers that's reached out, everybody who works in the city that has reached out to me to check on me. And I might not have got back to everybody because, you know, like I said, I was in the hospital, my phone was off, but, you know, I just appreciate it and stay safe. I appreciate the equipment. I'm looking forward to coming back to work and getting back on that front line and helping out the citizens of Mount Vernon, and stay safe, everybody, please.
thank you. Detective Clark?
I just want to thank everybody for all that they've been doing for me and my family. We haven't wanted for anything. I'm glad that we are in this Cash App and Zelle era because whatever I need, I just Cash App Zelle, and people just drop it off to the house. I just want to thank Mount Vernon PD, my command staff, everybody that's checking in with me. Um, it's important because when you're going through this, like the lieutenant said, you definitely need people to be reaching out to. And prior to me getting sick, I'm the EAP officer at the job. I was reaching out to everyone else. So it gets you through. Mount Vernon, we are definitely strong. We just got to get focused and, understand that this is just a trial and tribulation that we're going to get through. My group chats, appreciate you, love you. This is definitely, it's important to have your friends, your family, your coworkers. Thank all my coworkers, DPW, fire, police, all the grocery store workers, any essential person out there that's out there busting their butt every day. I appreciate you. Everybody stay safe, and hopefully I'll be out of this room by next week because this cabin fever is killing me. So God bless everybody. Love you, love Mount Vernon, and thank you for this platform.
Thank you. Thank you. Deidre, Miss Addison, Mrs. Addison.
I want to thank the department. I was one of the first waves that went through this, and they definitely, helped me feel better as well as you. You reached out, and the captain and Charlotte reached out. And I want to thank the community. The community has been extremely supportive with donating food, PPE. I had a friend who found out that the distillery in Yonkers started making hand sanitizer, and she drove it here and donated it the other day. And I'm just glad to be back. And I'm also glad to let people know that we can beat this. And, just stay positive, like Dave said before, just stay positive when you're going through this and take those precautions because I work inside. You would never think that I would get sick from COVID, but it can reach anyone, anywhere.
Thank you so much, Mrs. Addison. We really appreciate you. Ms. Ayers, our president of CSEA.
I just want to thank the administration. I know that just like you said, we are co-workers, but we are also family. Everybody in Mount Vernon is related one way or the other. And this has definitely taken a toll on all of us, seeing loved ones die and not be able to console who's left and not be able to pay our respects. But we appreciate all that you do. And I know coming in as mayor, who expected that there would be a pandemic, but you are holding it down. You haven't done anything as far as I can see. And I'm a big critic of everybody in that seat. You have done everything that you have done with us as our best interests at heart. So critics, there'll always be critics. So as long as you do what you're doing for us and in the best interest of this city, we are all behind you.
Thank you so much. And the last words will come from our Chief Addendo, our Incident Command.
Thank you again for the platform, Madam Mayor. Again, my appreciation.
Oh my goodness, we keep freezing. Okay.
Froze up, yeah. Two quick things. Firstly, I hope that we all heed the words of all of the COVID survivors that were handed out over this discussion. Us as a city, we understand that this is something very serious, nothing to play with, and that we should move and make sure that our behaviors reflect the seriousness and the gravity of what we're dealing with. And then the second thing, to kind of piggyback off of what the mayor was saying, just understanding the difference between social distancing and physical distancing, that we definitely want to physically distance, but that social part is going to be key, especially as we start to move, or as this crisis recedes. We're already seeing the mental health problems that are coming out of this pandemic, and some of the issues with people and the stress, the anxiety, the uncertainty that people are having to live with. And we're going to need one another after this is all over as well as while we're going through it. So just keeping that in the back of our minds as well. The post-traumatic stress that comes out of dealing with something like this. So stay in touch with people, reach out.
Yeah.
The mayor is very serious about connections and connecting people. And I think that that's going to be very important going forward. So
yeah. So as we end tonight, everyone, I just want to say thank you again. And tomorrow is at 7 p.m. our Mount Vernon claps for our essential workers and our first responders. So wherever you are in Mount Vernon tomorrow, we ask that you go out, you open your windows, you go outside in front of your house. If you have a pot and a stick, bang it, bang it, bang it. If you've been frustrated, stressed, and pissed because you had to stay in the house, use this as an opportunity. I was speaking to our councilman, Derek Thompson, about this. Go out, scream, holler, yell, bang a pot, clap your hands, stomp your feet, and just let's show some appreciation and some love, and let everyone see how strong and resilient our community is. Because that's who we are. We are the jewel of Westchester. We make no apologies about it. And we are shining and we are leading by example, and we continue to serve our residents every day. And so again, I'm just really proud of you. And the last thing that I want to say before we leave, everyone, please, if you live in an apartment, and I'll probably do a separate small Facebook Live about this. If you live in an apartment building, realize that when you walk into the front door of your apartment building in your lobby, you are still not safe. You have to make sure that you continue to use precautions in your lobby, in your mailroom area, in the hallways, in the trash compact area, in the laundry areas of your buildings. We are seeing increasing number of cases in our apartment buildings throughout the city. Not only are we seeing it here, they're seeing it in cities all throughout the county and towns throughout the county, because we let our guard down once we walk into our apartment buildings. But and even when you're in your own apartment house, your own apartment, or you're in your home that you own, we're seeing multiple infections within families. So just because people are friend or family doesn't mean that they cannot infect you. You still have to use precautions. You still have to use an abundance of precaution. And we have to make the assumption that everyone that we know is positive and can potentially expose us, because there are a lot of people who are asymptomatic. They don't know it. No one's trying to purposely infect someone. But if you don't know that you're asymptomatic and that you're positive, you can unknowingly infect someone. So we want everyone to continue to exercise precautions and exercise the physical distancing, and making sure that you're keeping your area sanitized. And if you don't feel that your apartment management is doing what they need to do to continuously decontaminate the public areas of your building, then you need to reach out to the Department of Health. You need to reach out to your building management company and say that there's more that they need to do to make sure that the people who are living in their properties are safe. We've seen buildings where we have over 10 cases and 12 cases. And unfortunately, landlords are telling people in these buildings that there are no cases. There are cases in so many of our buildings. So your landlord wouldn't know one way or the other if there is a case unless someone told them, because they don't have a list. That list is confidential. It is protected by HIPAA laws. And so we can't sit there and say these people are positive, but having over 1,851 cases, we have 1,851 known cases right now in over 1,100 locations in Mount Vernon. We just ask everyone to understand that this has impacted our entire community, and we ask that you continue to exercise an abundance of caution, take care of yourself, and take care of your families, and stay healthy. Thank you, everyone. God bless, and have a great night. Be well.